100 women pass through this room every month. At least 20 are from Canada. Since abortions are permitted in their own country, why do they come here to an abortion clinic in Detroit?
The reason varies. It can be because they don't want to take the chance to get approval for an abortion, or because they don't want to wait for the delay in getting an abortion. You know, the abortion decision is a hard decision to make, and anything that delays it makes it tougher.
And I was like a week away for 4 months being pregnant. Like, that's how close it was. They were, to me, it seemed like they were just stalling it so then I wouldn't have to get rid of it.
Delays and a lack of privacy. Two things you can count on if you get an abortion in Windsor. That's why an estimated 500 Canadian women go to abortion clinics in Detroit every year. Abortion is not legal in Canada, but for more than 15 years, it's been permissible under certain circumstances. The criminal code states an abortion can take place when a committee of 3 doctors at an accredited hospital rules that the continuation of the pregnancy would be likely to endanger the woman's life or health. That last word, health, has become the real stickler in this law. It's been left up to individual hospitals and individual doctors to define when a woman's health is in danger. Hospitals have tackled this in different ways. Some have established bylaws or a kind of protocol to help administer the law. For example, in some hospitals, the woman herself writes a letter to the abortion committee stating her reasons for wanting an abortion. That must be backed up by one doctor.
It's different here in Windsor. Here, 2 different doctors have to examine the woman and recommend that the abortion take place. Now, that's usually the family doctor and the gynecologist who's going to do the actual surgery. That doctor, by the way, has to be on staff at the hospital. We contacted officials at both Windsor Western and the Metropolitan to find out why these bylaws exist. Nobody would do an on-camera interview with us, but we did find out that a formal complaint has been lodged against the bylaws at Met, and they are now under review. That complaint was made by Helena Jasic. It states that the bylaw embellishes the criminal code, and that may cause dangerous delays.
I think on the whole patients say that this delay is very hard on them emotionally. Of course, medically it's not good either, because every delay in a pregnancy, meaning that the pregnancy is going to be, say, 2 to 3 weeks further advanced before the procedure is done, is going to increase the risk, the physical, medical risk of the procedure.
Whose idea is it to have the 2 doctors' letters and the doctor that must be on staff? Like, why is that existing?
It seems to me that this is an individual bylaw of the hospitals that have these regulations. They have simply kind of amended the criminal code further to restrict access, basically.
There are only 2 hospitals that perform abortions in Windsor, Windsor Western and Metropolitan. And there are only 2 or 3 doctors who will perform those abortions. Arthur Hanscombe is one of them.
I think originally, because I was asked to do it, no one else would do it. And I had no strong feelings against abortion.
What do your colleagues say about you?
To my face, very rarely disparaging, but behind my back, I don't know.